Good afternoon, everybody. Welcome to your health Q&A session for Tikmikshing and Anishinaabeg members. Today is May 28th, and welcome to this week's health Q&A. We have a panel of 4 today, which consists of Amanda Wabagijic-Jordan, Health Promotions Manager, Lisa Grew, she's our Home Care Manager, and James Boland, who works with Mama West Wing, a partner of ours, and he is the Addictions and Mental Wellness Counselor. James is here. He'll take part in the panel discussion with the questions, and also we'll have something at the end of the session just to go along with the Mental Health Awareness Month this month. So I will begin, and I will begin with statistics. So for Tikmikshing and Anishinaabeg, we have 0 positive cases and 0 people tested. For Ministry of Health, I receive these statistics every few days. So from the Ministry of Health, they are reporting that 292 cases were reported in Ontario today, bringing the cumulative case count to 26,483 people, and this includes 20,372 resolved cases and 2,155 deaths. In Ontario, a total of 644,547 tests have been completed, with tests performed at Public Health Ontario laboratories and non-public health laboratories. There's currently 11,817 tests under investigation. 847 patients are currently hospitalized with COVID-19. 150 are in ICU, and 117 in ICU are on a ventilator. Ontario Health North, this here replaces the Northeast LHINs, and what they do is they encompass 109 First Nation communities, and out of the 109 First Nation communities, 30 of those are remote areas. So it is a big area, so it does have a lot of data. The most recent data is as of May 26th. So 78.3% overall hospital occupancy level, 35.6% are critical care occupancy rate, and 684 hospital beds are available. There are 296 positive cases. Of these cases, 27 active cases across the north, and 11 are deceased. There are 43 assessment centers opened and operating. There is a positivity rate of 0.7% in the north, compared to the 4.2% provincially. 4 out of 64 long-term care homes are in an outbreak, which include the Elizabeth Center, Manitoulin Lodge, South Centennial Manor, and East Home in Powassan. There are no retirement homes in outbreak. We did receive an email advising that there was a recall issue on hand sanitizer. There was a technical grade alcohol foul smell, and they are cautioning those who are either pregnant or nursing, or and not to let children, or if you have a broken skin, not to use that product. So the recall, you can call the company back and ship it back. So that is that for the statistics. We will go on to the questions. And this week, we basically looked at testing and also symptoms. Symptoms have, they have increased the number of symptoms, and where we receive all of our information is through Public Health, Sudbury and Districts. So you're always welcome to go and visit that site to get a up-to-date information on symptoms and testing. So we'll go ahead and start with Amanda.
Okay, so symptoms of COVID-19 can range from mild to severe. So the most common symptoms of COVID-19 include the fever, new or worsening cough, difficulty breathing, shortness of breath. The other symptoms of COVID-19 can include a sore throat, difficulty swallowing, loss of taste and smell, nausea, vomiting, diarrhea, abdominal pain, runny nose or nasal congestion in absence of underlying reasons for these symptoms such as allergies and postnasal drip. There are asymptomatic symptoms, and if you would like to learn more about that, please visit the public health website that can be found on the
Thank you. Lisa?
My topic is what to do if you suspect you have symptoms of COVID-19. So if you think you have symptoms of COVID-19 or have been in close contact with someone who has COVID-19, you should isolate yourself right away, which means to just keep your social distance from people. And you want to protect others and protect yourself from spreading the virus. And so you keep your distance, you wear a mask if possible, and wash your hands often. If you're having any difficulty breathing or experiencing other severe symptoms, call 911 and advise them of your symptoms and any travel. Find out if you should seek medical attention. You can call a local COVID-19 assessment center or use the online self-assessment tool, or call your healthcare provider or Telehealth Ontario. So for general information about COVID-19, call the Sudbury District Health Unit at 705-522-9200. The Ministry of Health also has an online self-assessment, and you can go to their site to find out more information. Telehealth Ontario, you can get medical advice from them at 1-866-797-0000. Or you can call your healthcare provider, so your doctor or nurse that you see regularly, and let them know about the symptoms that you're having. And if you do go see them, wear a mask, and that's so that you prevent transmitting or spreading the virus.
Thank you, Lisa. Next is James.
Honey, so who is eligible for COVID-19 testing? Testing for COVID-19 is based on a clinical assessment of each person. The priority as a health system is for testing to inform clinical and public health management. Testing is available for all people with at least one symptom of COVID-19, even for mild symptoms. People who are asymptomatic and who are concerned that they have been exposed to COVID-19. This includes people who are contacts of or may have been exposed to a confirmed or suspected case. People who are asymptomatic and who are at risk of exposure to COVID-19 through their employment, including essential workers. For example, healthcare workers, grocery store employees, and staff at food processing plants. Testing continues to be a priority for those who are at risk of more severe disease or those who live or work in settings that are at higher risk. Priority groups include hospital inpatients, residents of long-term care and retirement homes, healthcare workers, caregivers, care providers, paramedics, and first responders, including police and firefighters. Remote, isolated, rural, and indigenous communities also. Remote, other congregate living centers, including homeless shelters, prisons, and group homes. Specific vulnerable populations, including patients undergoing chemotherapy or hemodialysis and requiring transplants, as well as pregnant persons, newborns, and cross-border workers. Other essential workers as defined by provincial orders. Those are the priority groups. Miigwech.
Thank you, James. What does testing tell you? The test detects COVID-19 virus in your body at the time of testing. If you have been exposed, and are in early days of incubating the virus, it may not be detected. Testing will not tell you if you were previously infected, as the antibody test is not yet available. It is important to maintain other public measures such as hand washing and physical distancing. Amanda?
So who determines who gets tested for COVID-19? The Public Health Sub-Region Districts does not decide who gets tested. Our agency will refer individuals to a healthcare provider who will make a clinical assessment and decide whether testing is recommended or not. All specimens will be tested by the laboratory, but the tests will be analyzed in priority sequence. Those who are at risk for more severe disease or those who live or work in settings that are at higher risk are given the higher priority.
So just to clarify, the agency, that is Public Health, Sudbury District's agency. Okay, Lisa?
What is the role of public health in testing? Public Health Sub-Region District is one agency individuals may contact if they're concerned about their symptoms as it relates to COVID-19. The Public Health Unit may make a recommendation about whether an individual should receive testing. If you feel that you should be tested, call the health unit and they will advise you of their process.
Thank you. James?
And who is responsible for COVID-19 testing? COVID-19 testing, the actual swabbing, is done in a number of different venues in the region. Testing is done at Ministry of Health funded and approved COVID-19 assessment centers, but may also be done by others, including local healthcare providers. COVID-19 assessment centers. What's important about these centers are that they're for clients who require further assessment and possibly testing. Appointments are required, walk-ins are not seen there, and they won't be seen. Do not present yourself at an emergency department or healthcare provider's office. Drive-through or mobile testing options may be provided. Check with your nearest assessment center for more information and follow these instructions. Health Sciences North Assessment Center. Client must call 705-671-7373 between the hours of 9 a.m. and 5 p.m. 7 days per week. And there's a link here for the assessment center online information. Other assessment centers, Manitoulin Health Center, MHC Assessment Center, Espanola and Area Communities Assessment Center, and the Chapleau Assessment Center.
Okay, thank you, James. How can you find out test results? You will be able to access your COVID-19 lab test results through a secure online portal by the Ministry of Health. And once you're completed your testing, the assessment center, they will give you that information. And we do have 3 assessment centers in Sudbury plus drive-through.
So how does Public Health conduct follow-up after a positive test result? When Public Health Sub-Region District receives notification of a positive test result, our staff will follow up with the individual who has the positive test result for COVID-19. A person with a positive test result is called a confirmed case. Public Health gets in touch with the individual who is a case as soon as possible following reporting of the case to Public Health. Public Health professionals discuss the test results and explore possible exposure settings as well as close contacts of the case. Instructions and follow-up actions are provided based on this conversation. These instructions will cover how to self-isolate, how to self-monitor for signs and symptoms, ways to prevent or control the spread of infection, and how to properly clean living environments. Public health professionals will also answer any questions an individual or family may have. Individuals with COVID-19, the cases, will receive daily follow-up by the public health professionals to monitor their symptoms and the progression of the illness, monitor the resolution of the symptoms, and to ensure ongoing self-isolation. It is critical that the individuals with COVID-19, the cases, maintain self-isolation, including from people living in the same household until told otherwise by public health, so that they do not spread the infection to others.
So it's really important, if you do have a positive case, you can contact Marina or myself. And if you're unable to isolate in your home, meaning you have a room designated just for yourself, and to limit that spread, you'd have to, make sure cleaning, if you have to use a bathroom that's shared with everybody else, a lot of cleaning efforts, disinfection would have to take place. Marina can educate you on all of that, along with public health. Lisa?
Contact tracing. At the same time that public health conducts follow-up with the confirmed cases, our public health professionals also begin a process called contact tracing. Through this process, public health professionals identify people who may have been in close contact with a person with COVID-19 during the period of time when the person may have been able to spread the infection. The purpose of identifying these contacts is to provide people with important direction to reduce the spread of infection to others. Examples: self-monitoring, work-related direction, and self-isolation.
Thank you. James?
Some examples of people who are considered close contacts of a case of COVID-19 are people living in the same household, people having direct or close physical contact with a case, people having direct contact with respiratory droplets of a case, for example, shaking hands that have been coughed on or sneezed on, or touched used tissues with bare hands.
Okay, thank you. So close contacts of a case. Once public health professionals identify close contacts, they immediately follow up with each person individually to provide public health information and direction. Close contacts of cases receive regular contact to ensure they are following any public health direction provided. Not all contacts of a person with COVID-19 will develop infections. The risk of infection depends on a number of factors to determine the level of exposure. Public health professionals use the level of exposure of each contact to determine the required public health direction. Public health Sudbury and districts will continue to follow up with both cases and contacts until they meet the criteria for resolution and can discontinue their isolation and/or monitoring. With relation to Tikmikshing members living in the community, public health contacts First Nations and Inuit Health Branch, and they are with Indigenous Services Canada. Indigenous Services Canada, once they obtain that information, that positive case, they will contact Marina McCumber, our community health nurse, and then she will take over on the contact tracing. So this process has always been here in the community for contact tracing, and it's with all communicable diseases. And COVID-19 has been added to the communicable disease list. So that is how the contact tracing will be completed in Tikmikshing.
Okay, so how does COVID-19 spread? Coronavirus are spread mainly from person to person through close contact, for example, in a household, workplace, or healthcare center.
Lisa?
How to protect yourself and your family. Simple, easy, and routine hygiene practices can reduce the spread of germs and help you stay healthy. Washing your hands is an important part of your daily routine. It is your best defense against spreading illnesses such as coronavirus, influenza, colds, foodborne illnesses, and norovirus. Learn more about hand washing and tips to help reduce the chance of getting an infection or spreading it to others. Cover your mouth and nose when you cough and sneeze. Use a tissue or cough or sneeze into your sleeve if a tissue is not available. Throw used tissues into a garbage can right away.
Mhm. Okay, so that's, thank you, ladies. That's, and James, that's it for the questions. So if you have any questions with regards to the new symptoms or with testing or with anything with COVID-19, you can always call myself, Marina McCumber, one of the managers, and we'll get you the information that you require.